And hello there. Welcome to our Friday Lunch and Learn. Here with me, Dr. Polly Heil-Mealey, and today we're going to be saying some cuss words, okay? One of them that I want to talk about is body mass index. Now, why do I say that's a cuss word? Well, because we know if your body mass index is over a certain percentage, then we know that you are on the way to obesity, and we know that if you're on the way to obesity, then you can have a lot of other issues, okay? And that's what we don't want, okay? So I know I kind of talk about this a lot, but inflammation is a big deal, and where you carry your extra fat in your body is also a big deal. And so some of us, I carry, if I'm going to be heavy, I'm going to be heavy on my hips and thighs. Other people, if they're going to be heavy, they're going to be heavy in the abdominal area. And so we're going to show today some statistics that it's better to be a hip and thigh person than it is to be a chest, waist person. Okay, we're going to get into some details on that, but we're talking about today inflammation and COVID-19 and how body mass index affects that. So I've got two articles here. I've actually got three, but I don't think I'm going to get to all three of them today. So we find that inflammation, the inflammatory response, is a key indicator on how you're going to survive and how serious a COVID-19 infection would be, okay? So it says here that the virus disproportionately affects men, okay, they get it worse, and people who are older who have conditions. We know these are the comorbidities, all right, of diabetes and obesity, all right? So why is that? Because obesity and diabetes have one thing in common, and that is too much glucose in the cells. We're going to get to that, all right? It's becoming clear that for these high-risk groups, it is the inflammation that is responsible for their immune system having this cytokine storm, okay? It says that the common feature for many patients that get severe COVID-19 is serious lung damage caused by overly vigorous immune response. This is characterized by the creation of a lot of inflammatory products called cytokines, these so-called cytokine storms. Cytokines can be really powerful, okay, with the immune system, so that's a good thing, but they can be overactive, and that's what we don't want. So if you are a diabetic, okay, diabetes that is not well controlled can result in high levels of glucose in the body. A recent study showed that in COVID-19, macrophages and monocytes respond to high levels of glucose with worrying consequences. Now, what are these things? These are monocytes and macrophages are in your lymphatic system. Now remember, you've got lymph nodes in your neck, right behind your ear, under your jaw, in your armpit, down your spine, in the groin area, and behind your knees. So this is where all of your lymph nodes are. This is the main part of your lymphatic system. I call the lymphatic system the housekeeper of the body because the lymphatic fluid goes into all of your cells, it gets into all the extracellular spaces, and it cleans out all the metabolic debris, it cleans out all the trash, cleans out the viruses, the bacteria, and that kind of thing. So I call it the vacuum cleaner of the body. Now, if your lymphatic system is not working properly, then you're going to have a problem. So your macrophages, now if you're of a certain age, okay, your macrophages are little Pac-Man-like creatures, right? And they gobble up all the things that are not supposed to be in there. Monocytes are a certain type of white blood cell that rises, your levels will rise when you have parasites and when you have any kind of infection. Now, if you are a diabetic, these macrophages and monocytes, which are part of your immune system, are going to be flooded with glucose. Let me see if I can get the exact quote here, okay? It says, diabetes, if not controlled well, can lead to high levels of glucose in the body. A recent study showed that the COVID-19 macrophages and monocytes respond to the high levels, okay? these monocytes and macrophages responding to the high levels of glucose actually pull the COVID-19 into the cells, okay? It facilitates them entering the cells. So sugar is not your friend. Glucose is not your friend, because it is going to be like the virus can piggyback onto that, get into the cells, and then cause you some problems. It says once the virus is safely inside the cells, it causes them to start producing a lot of inflammatory cytokines, effectively kick-starting the cytokine storm. And the higher the level of glucose, the more successful the virus is at replicating inside the cells, okay? Essentially, the glucose fuels the virus. So I want you to make a note here. Glucose fuels the virus. Okay, this is really, really important, because when I get to my next piece, which is talking about body mass index and visceral fat versus subcutaneous fat, right? The visceral fat has more glucose in it. Okay, so if you have that barrel chest, if you carry all of your weight in your gut area, if you've got a muffin top, if you're a girl, if you've got a beer belly, if you're a guy, then you've got that visceral fat issue, which has too much glucose in it, which is going to fuel the virus if you have it. It feeds the virus, okay? Obesity also causes high levels of glucose in the body, similar to diabetes. It affects the macrophage and monocyte activation. Research has shown that macrophages from obese individuals are an ideal place for the SARS-CoV-2 to thrive. Now, we know that obesity, right, I think is 30 pounds over your ideal body weight. If you calculate your body mass index and you are in the obese area, right, then you are going to facilitate a thriving COVID-19 infection. So we don't want to be talking about and weight shaming and all that kind of stuff. That's not the point. The point is that this is something that's really, really important, because when you have that extra fat store, your inflammation is higher. If your inflammation is higher, then you're going to have a greater propensity to disease. Now, with obesity, and I think that's 30 pounds over your ideal body weight, okay, you are twice as likely to become diabetic. If you become diabetic, you're 4 times more likely to become a cancer patient. So, exercise, watching your diet, making sure that you're healthy, making sure that your inflammation is down is really, really important. Now, on your blood work, triglycerides are a factor in inflammation. So is your CRP, okay? So you want to make sure that those levels on your blood work are not high, because if they're high, they're showing chronic inflammation. If you have chronic inflammation, then you are at high risk for disease. Now, there are other risks of inflammation. It says the same sort of inflammatory profile for diabetes and obesity cause has also been seen in some older people, those over 60, raise your hand, okay? This is due to a phenomenon known as inflammaging, okay, which is kind of an interesting word, okay? It is characterized by having high levels of pro-inflammatory cytokines, which influence a number of factors, including genetics, okay, the microbiome, that is your bacteria, your viruses and other microbes that live inside and outside of you, and, nasty word again, obesity, okay? Many older people have fewer lymphocytes, and these are the very cells that specifically target and destroy viruses. So just look around. We know that as people get older, they get heavier, right? We do know that young people are heavy too. We've got grandchildren that are heavy. We've got teenagers that are heavy. We've got young adults that are heavy. So obesity does not play favorites, okay? But we do know that as people get older, they tend to get heavier. Now, I remember I had just turned 50, so that was some years ago, and I got on the scale and I was absolutely horrified at my weight. And I went to see my doctor and he said, oh, well, you're over 40 and you can expect to gain 10 pounds every year. And it's like, what? I do not want to gain 10, not every year, every decade, pardon me, 10 pounds every decade. So that means I'm going to be 10 pounds heavier in my 50s, I'm going to be 10 pounds heavier in my 60s, I'm going to be 10 pounds heavier in my 70s, and so forth and so on. So that is not true because I am 40 pounds less than I was on my 50th birthday, right? So how do I do that? I make sure that I take care of my inflammation and I watch what I eat and all that kind of good stuff, which is what we tell you to do, diet and lifestyle changes, because you don't have to get heavier as you get older. But the studies are most of the population does get heavier because their doctors will tell them, oh, you're over 40, you're going to gain 10 pounds per decade, right? And that's your doctor and you're going to trust your doctor, right? And that's what we do. All right. All this means that for some older people, their immune system isn't only poorly equipped to fight off an infection, but it is much more likely to lead to a damaged immune response. Having fewer lymphocytes also means that vaccines may not work as well, which is critical to consider when planning a future COVID-19 vaccine campaign. So if you've watched any of my podcasts or any of my videos, you know that I am not a proponent for vaccines. Now, why is that? Because of the heavy metals, the adjuvants that they put into the vaccines to cause an immune response. I'm not a fan of formaldehyde. I'm not a fan of aluminum. I'm not a fan of thimerosal and mercury. All of those components cross the blood-brain barrier and set up inflammatory processes in the brain. If you've been listening to our videos in the last 2 or 3 months about the COVID-19 vaccine, we are understanding from experts, vaccine experts. I am not a vaccine expert. I am not a medical doctor. I am a researcher, okay? And so we're understanding from the people that know, the epidemiologists and the virologists, the ones that work with these little particles in our body, that this new COVID-19 is going to have nanobots in it that are going to cross the blood-brain barrier. There's all kinds of videos out there. There's all kinds of patents out there. You can do your own research. I don't particularly favor vaccines, not because of the virus, but because of all the things they add to it to elicit an immune response, okay? So I don't want to do that. I don't want you to do that either. But if the COVID-19 virus affects people over 60, it affects people that are obese, it affects, all the people that it affects. And we know that if you have a damaged immune response when you're that age as well, then we know that a vaccine is not necessarily going to be the answer to what you need, okay? So coming over here to belly fat, right? We're talking about that BMI again. Belly fat is linked to higher risk of premature death, okay? Premature death regardless of your weight, all right? So how do you factor body mass index? I've got my little note here, I've got my little note over there because I want to see what it is. Body mass index is your weight, divided by your height squared, okay? So for us in the United States, you would take your weight, pounds and ounces, okay? Then you would divide it by your height squared. You can get on the computer, you can get on Google, you can get a body mass calculator, you can put in your weight, you can put in your height, boom, they give it to you, okay? So if your body mass index is high, then you are at a higher risk of premature death, okay? I don't like that. Not all fat is the same or has the same effect on your health outcome. So this is really important. It is well known that carrying extra fat around your waist can be harmful to your health, bringing greater risk of developing illnesses such as type 2 diabetes and cardiovascular disease, okay? But a recent study found that regardless of weight, people who carry more fat around their abdomen had a higher risk of dying sooner. In fact, there was an 11% increase in death during the follow-up with every extra 4 inches of waist circumference. All right. So this is really, really important, okay, that we look at what our BMI is, because we do not want to have any kind of issue with that. All right. The researchers, now this is a big study. The researchers included 72 studies in the review, which contained data of 2.5 million people. So that's a lot of people, okay? They analyzed their body shape measurements looking at hip to waist ratio, waist to thigh ratio, and waist to thigh circumference. In other words, all the places where we carry our extra fat, okay? My late husband used to say that I was plumptious, okay? He would never say that I was fat or that I was heavy, but I was plumptious, which is an endearing term, okay? But it's not good for your health. I am never going to be a bodybuilder. I don't think women should be hard. No offense to all of y'all out there that do that. That's great. If that makes you feel good, that makes you feel good about yourself, then that's fine. I personally want to be soft. I want to be a little squishy, okay? I remember a student, Michelle, who came up and put her arm on she put her hand on my forearm, and she said, "Ooh, Miss Heil-Mealey, you're a little bit squishy." I am a little bit squishy. I think women should be soft. I think that's part of how we are built, okay? Not flabby, not hard, okay? I don't like to be hard. All right, so this says, besides the findings on belly fat, the researchers also found that people who tend to store more fat in the hips and thighs instead of the abdomen had a lower risk of dying prematurely, okay? Each extra 5 centimeter thigh circumference associated with an 18% reduced rate of death during the follow-up, okay? So, I don't particularly like heavy thighs, I'm just saying, but the research shows that if you carry your extra fat in your thighs, that you are reducing your risk of death prematurely. So that's kind of a cool thing for us hip and thigh girls, okay? When I lived in England, I don't remember who wrote the book, but there was a book. You can probably get it on Amazon. You can probably get half-price books. It was called The Hip and Thigh Diet. And it told you if you got rid of this, that, and the other, that you would lose weight. And because that's where I carry my weight, and remember, my husband called me plumptious, I did that diet, and sure enough, I lost tons of inches. I can't remember how much weight I lost, but my body shape changed drastically. And I'm very glad that I did that diet because it was just good. It was good for me, okay? So body fat, known as adipose fat, plays an important role in our physiology. Its main purpose is to take glucose from the blood and safely store this energy as lipids inside our fat cells, which our body uses as fuel, okay? Our fat cells also produce hormone signals that influence many body processes, including your appetite. So adipose tissue is important for good metabolic health. Metabolic health means calories in, fuel burned, hopefully weight loss and not weight gain, okay? So that's really, really important. Although fat is important for good metabolic health, where we store it and what kind of fat it is can have different health consequences. Research shows that people of the same height and same weight, but who store their fat in different places, have different risks of developing certain metabolic diseases such as type 2 diabetes and cardiovascular disease. So let's say I'm 5'10" and I weigh 150, and my girlfriend's 5'10" and she weighs 150. If I store my extra fat, hip and thigh, she stores her extra fat at her waist, she is going to have a different health outcome, and she's going to be more predisposed to becoming a diabetic or to having cardiovascular disease than I will because of just the way I store my fat. Okay, so this is important. So fat that is stored in your chest area or your waist area is called visceral fat. Fat that is stored in the hip and thigh is called subcutaneous fat, okay? So body shape is influenced by where the fat is stored in the body. For example, apple-shaped people store more fat around the waist and are likely to store more fat deeper in the body, okay, surrounding their organs as visceral fat. Pear-shaped people have larger thighs and store more fat more evenly around their body just under the skin as subcutaneous fat. Visceral fat is considered more insulin resistant, so carries a higher risk of type 2 diabetes. Fat stored around the waist also releases more blood triglycerides in response to stress hormone signals compared to the hip and thigh fat, okay? High blood triglyceride levels are associated with greater risk of heart disease, right? This is partly why visceral fat is seen as more harmful than subcutaneous fat. So in your blood work, you get your lipid panel, you get your cholesterol, your LDL, your HDL, and your triglycerides, okay? So I like to say that your triglycerides are how you manage what you're eating. But we do see people that have a very, very good diet that have high triglycerides. What I'm finding is that the high triglycerides are due to visceral body fat, not necessarily what they're eating. Now, that doesn't exclude the fact that some people eat just garbage diets. They're going through fast food places all the time. They're eating a lot of processed food. They're eating a lot of food with additives and that kind of thing. So they are going to have a higher triglyceride. On your cholesterol panel, you want your cholesterol, and I know there's going to be some controversy about this, so you're going to have to research it yourself. Medical profession wants your cholesterol level to be close to 100. I was told that by a medical doctor a couple of years ago. On your panel, when you get your blood work done, it says it wants your total cholesterol number to be under 200. I'm okay with that. 200, 220, I'm good with that. Back in the 70s, most people had cholesterol 220, 240, and nobody batted an eye. An article came out, or a study came out, and it said that if your cholesterol was over 200, you were going to die of heart disease. That study has never been able to be repeated. It's never been able to be replicated at all. So most people that do research have thrown that out. The reason I like your cholesterol to be around 200 is because every cell in your body needs cholesterol. Every cell membrane is made up of cholesterol. Your brain, I think, is about 80% cholesterol, right? So if you have a cholesterol that's very, very low, I saw a lady this week, her total cholesterol was 79, way, way low. Now, she's a very sick lady, all right? She doesn't have enough cholesterol to go around. Her bad cholesterol, so-called bad cholesterol, your LDL, that is an inflammatory marker. And we have seen that if we, through lifestyle and diet, we get the inflammation down, then that LDL comes down as well. So in my opinion, LDL is an inflammatory marker. HDL is a marker of liver function, and you want that to be a high number, over 60, okay? So all of your different fats have different aspects to your health. What we're finding is people with a high body mass index have high triglycerides because the visceral fat holds more glucose, and when it is released, it makes your triglycerides high. Now, your triglycerides being high is an indicator of cardiovascular disease. So this is why this is so important. On the other hand, hip and thigh fat can better take up the triglycerides from the blood and store them safely. Visceral fat does not, okay? It prevents the body from incorrectly storing them in the muscles or the liver, which can cause liver disease. So if you have the visceral fat, you have more triglycerides, then you're also having liver damage there. Subcutaneous fat tissue can also develop specialized beige fat cells that help burn fat. Now, if you've studied fat cells, you've got dark fat cells and you've got white fat cells. Your dark fat cells are the ones that make you puffy, okay? But now they've got this new one, the beige fat cells that help you actually lose weight. So that's really kind of good there, okay? Visceral fat can cause inflammation, eventually leading to metabolic and cardiovascular disease. And if the fat can no longer be stored in the adipose tissue, eventually lipid can accumulate elsewhere, including the heart, your muscles, and your liver, which again lead to disease, okay? Unfortunately, it says this means it might be more difficult for the person who naturally stores fat around the waist to maintain good health. But research also shows that weight loss can reduce visceral fat and improve metabolic health. So what is important to remember, okay, is that body shape is only a risk factor. And even with these differences, you can still lower your risk of chronic disease if you maintain a healthy lifestyle. So again, not fat shaming anybody, not throwing stones, not anything like that. I want you to be healthy. Our videos, all of our social media is all about education. If I can give you education, maybe fill in some pieces that your doctor's not telling you or you're not getting it on your own in your research, I can help you do whatever you need to do so that you are going to avoid having the metabolic issues that cause more glucose to be stored in the cells. If the glucose is stored in the cells, then it fuels the COVID response, okay? So that all tie together. Hopefully it did. I've got another article that talks about inflammatory foods and non-inflammatory foods. You can probably Google that for yourself. Make good choices, okay? If you know that you carry fat around your waist, then you need to be very concerned and figure out what it takes for you to be able to lose that. That's highly, highly important to avoiding metabolic diseases. Cancer is a metabolic disease, okay? So we like to say in holistic land, right, that every symptom is a healing strategy. We don't work like the Western medical profession works in that you go in with a symptom, they give you a drug to suppress the symptom. You feel better, but at the root cause, nothing has changed, okay? We look at what the problem is, find the root cause, and the root cause of every sickness, every disease is inflammation, okay? Your immune system should have an inflammatory response. I am healthy, I feel good, but if I walk out that door, come face to face with somebody that's got something, and it gets on me, a bug, a virus, a germ, whatever, my immune system should mount an inflammatory response to tell all of my white cells, all of my macrophages, my monocytes and all that, go, 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 get whatever just invaded this human, right? That is a good thing. Chronic inflammation that goes on day after day, week after week, month after month, year after year, okay, weakens the immune system. Visceral fat, body mass index that's too high, okay, is an indicator of chronic inflammation. If you have chronic inflammation, if you get COVID-19, it's going to be worse for you because of all the glucose stored in the cells. It's going to feed the virus. We don't want that, okay? But what I want you to do is look at your health. I want you to be around for a long time. I want you to prevent any metabolic disease, type 2 diabetes, okay, cardiovascular disease, and cancer, okay? Hopefully you've gotten something out of this video. Was it too controversial today? I hope so. And it is the weekend, so take good care of yourself. Do a lot of self-care. Know that I love you. I'm here for you. Give me some questions. If I didn't make something clear, if you have a topic you want us to discuss on these Friday Lunch and Learns, let me know. I'll be happy to take care of that. Take care of yourself. Enjoy the weekend. And it is truly fall here in South Texas. Take care. Love you. Bye.